Welcome to Ajit Bioacademy. Today I will talk about adrenergic receptors, their location, function, and associated agonist, antagonist with specific indications. Okay, so our today's topic is adrenergic receptors. So before going to the details, just we should know about the background of adrenergic receptors. Okay, so first of all, in our autonomic nervous system, it has two wings. One is sympathetic nervous system, another one is parasympathetic nervous system. Okay, so sympathetic nervous system actually responsible for fight and flight mode. That means you are in danger situation or you are in emergency situation or you are performing exercise. Then at that time, nervous system will help you to perform such type of activities. Okay, so that nervous system is sympathetic nervous system, and the master molecule of the sympathetic nervous system is adrenaline and noradrenaline. Okay, adrenaline and noradrenaline. That means epinephrine and norepinephrine. Okay, these are the master molecule of your sympathetic nervous system. You can precisely call them like adrenergic neurotransmitter. That means those will come from the specific nerve, that is sympathetic nerve, and that will activate a particular receptor, then it will show its activity. Okay, so these are the adrenergic neurotransmitter, and it will work on a particular receptor. Those receptors called adrenergic receptor. Okay, so adrenaline, noradrenaline. So from that point, adrenergic neurotransmitter, then adrenergic receptor. So as you know, a receptor, what is receptor, or the types of receptor. So if you want to know more, then you can go back to my channel for the receptor types of receptor, G protein coupled receptor, like that. Okay, for your better understanding. So now I will go for details. Adrenergic receptors. So adrenergic receptors basically two types on which adrenaline, noradrenaline basically work. Sometimes dopamine can be considered, but actually we will focus on adrenaline, noradrenaline as a master molecule for adrenergic neurons. That means your sympathetic neurons. Okay. So now adrenergic receptors are basically two types. Okay. Two types. One is alpha, another one is beta. Okay, it's basically two types: alpha adrenergic receptors and beta adrenergic receptors. And it has also subdivision, that is alpha 1 and alpha 2. It has three subdivisions, that is beta 1, beta 2, and beta 3. Actually, alpha 1 has also some another subdivision. But for easy understanding, according to the basic major organs, then if we consider in such a way, that will be very sufficient to explain the adrenergic activities or adrenergic receptors. Okay, so this is alpha adrenergic receptors, alpha 1, alpha 2, and beta 1, beta 2, beta 3. So according to the types of receptors, all the adrenergic receptors are G protein coupled receptors. So if you want to know more about G protein coupled receptor, you can search my channel for G protein coupled receptor. Okay. So now I will just try to give you some brief about the G protein coupled receptor category. And when we will explain each and every receptor with the signaling pathway, then over there I will explain in details. So here alpha 1 is basically the GQ type of G protein coupled receptors. GQ, you know, the GQ is connected with the phospholipase C enzyme oriented, and here the alpha 2 is basically GI, that is inhibitory G protein. This is GQ and this is GI, and all the beta adrenergic receptors are GS, G protein coupled receptor, that is stimulatory G protein coupled receptor. This is inhibitory, and this is GQ, that is phospholipase C oriented G protein. Okay, so this is the basic one. Then I will go for the details. So before going to the details, we should know about the specific locations of the receptors and their major functions. Okay, so first of all, already I started with a sympathetic, that is fight and flight mode, in that way. So now I will explain in details. Suppose you are doing a rigorous exercise. Okay, so what will happen? Your heart function will increase, your lung function will increase, your skeletal function, muscle function will increase. Otherwise, it's not possible to perform exercise. Okay, suppose you are running. So what will be happening here? Your heart function will increase, that means your heart rate will increase. What is the purpose of increasing heart rate? That will increase your cardiac output, and that will increase the blood flow to the body. What is the function of increasing your lung function? Because lung will associate you to take more oxygen, and that will circulate throughout the body for your making the energy, that means respiration. If you think your skeletal muscle also, also over there, blood flow to be increased, and also you can say energy production also should be increased over there. So who will help them? So over there, that is heart, your lungs, your skeletal muscle. If you just focus on that point, then you have to consider if it is to be circulated more blood to that areas. So at that time, your body will manage all over the body's blood circulation to be limited. All over the body, blood circulation will make very limited by some specific mechanism, and then it will manage more blood flow to the skeletal muscle, your heart, and your lungs. Okay, so let's suppose in your family someone is falling in danger, so everyone should focus to him or her to help him out from that situation. Okay, so the concentration towards him or her, like that. So how? Actually, in our normal situation, throughout the body, blood is circulating in a very normal manner, according to the demand. The blood is circulating to the specific organs, to the specific tissues, to specific cells, okay, in a very normal manner. But when you will be in danger or you are in emergency situation, so of course the blood circulation to be circulated in a particular area more than normal, and when you will circulate more than normal blood to that area, of course other area to be limited. Okay, so that is the point. For better understanding, I will just explain with an analogy. That means, suppose you are in anger mode or you are afraid about something, then what will happen? Your eyes will be dilated, your respiration rate will be more. If you touch your chest, then you will feel your heart rate is more than normal. At that time, if you think you are in anger mode, or you are in danger, or you are in running mode or exercise mode, so it will be less tendency to urinate, or you can say to go for washroom. So how it is managed? Your heart rate is more than normal, your respiration rate is more than normal, and suppose you are doing exercise, so lots of energy is very necessary to increase the skeletal muscle performance. So how it will possible? So over there, blood circulation should be more, blood vessel will be dilated, and when your total blood volume is regulated and controlled by your kidneys or by your heart, so when in one area where blood circulation to be more than normal, then of course another area to be to make it limited blood flow, then it is possible to manage more blood to the skeletal muscle, more blood to the lungs. Okay, so if you think in that way, then it will get a precise message. Of course, it has a very beautiful regulatory system. Okay, so that regulation is actually regulated and controlled by the sympathetic nervous system, and behind the scene, adrenaline or adrenaline. And more specifically, there is the different types of receptors. They are very much rich in particular areas. Okay, so all the receptors, adrenergic receptors, alpha, beta, alpha 1, beta 1, alpha 2, beta 1, beta 2, beta 3, all the receptors are basically present throughout the body, including brain. But we are talking about the autonomic sympathetic nervous system, so we will just focus on the major organs or systems of the body other than brain. Okay, so now, if you just try to categorize the receptors in a manner, then it will be very easy to explain it. So, suppose already you got alpha 1, alpha 2, here beta 1, beta 2, and beta 3. The receptor category already we discussed. So, if I just try to explain, already I said sympathetic nervous system just responsible for fight and flight mode. So most of the time you can say it is excitatory. You are in a very emergency situation. So how will categorize now? So think about it. Firstly, you should consider as a prime responsible excitatory receptor is alpha 1. Okay, in our most of the areas, most of the smooth muscles, glands, alpha 1 is very much rich. To just through this alpha 1, you will get sympathetic or excitatory activity. So this is the stimulatory receptor. Okay, prime, and some exception, with some exception, like here, this is your heart, this is your kidneys. So over there, the stimulatory receptor is exception. In heart, very much rich, beta 1. In kidney, in particular area, beta 1 is very much rich. So in that way, you will just think for sympathetic excitatory activity, mostly alpha 1 and beta 1 are responsible. Receptor are responsible. So alpha 1 is present throughout the body, and prime receptor, with some exception, heart and kidney. So beta 1 and alpha 1 is actually responsible for stimulatory. Okay, and here if you think inhibitory, then you can consider that is beta 2 as a inhibitory. Okay, actually inhibitory means based on the stimulatory of sympathetic nervous system. You can say in that way, beta 2 activity is just opposite of alpha 1 in most of the areas, with some exception. Beta 2 is basically responsible for downstream activities, but sometimes it can also responsible for upstream activities. Okay, so this is beta 2. So for the inhibition activity, beta 2 can be the prime responsible receptor, but with some exception, like your nerve ending over there, that is nerve ending. Here alpha 2 is mostly present. Okay, and if you think your secretory glands like pancreas, beta cell, over there alpha 2 is present. You can consider the platelet, aggregated platelet, also alpha 2 there. Okay, so inhibitory function according to the sympathetic nervous system, then beta 2, but inhibitory function also done by the alpha 2 in different location. Okay, so in that way, if you just categorize, so alpha 1 and beta 1 is mostly associated with stimulatory function of the sympathetic nervous system. Beta 2 and alpha 2 is basically responsible for inhibitory, but it has some exception. And here beta 3 is basically present in adipose tissue, urinary bladder, and other places. It is almost the identical structure of beta 1. So activity should be like that. Okay, so now I am just trying to give you some brief as per the category of the receptor, and now I will go along with them with my analogy. That means where your blood flow to be increased and where to be limited. Okay, so now I will go for the discussion with organ system like that. So now in blood vessel, in your blood vessel, smooth muscle, blood vessel. Okay, so already I said throughout the body, blood vessel to the liver, blood vessel to the kidney, blood vessel to the pancreas, blood vessel to the spleen, in like that. So blood vessel, in blood vessel, most of the times, you know, this is your artery, this is your arteriole, and these are the capillaries. So in the sphincter areas over there, alpha 1 is very much rich, alpha 1, okay, in blood vessel throughout the body. But exception, because during emergency situation, blood flow to be more in your lungs as well as skeletal muscle. So in lungs and skeletal muscle, in blood vessel carry beta 2 receptor. Beta 2 receptor very much rich in the blood vessel of lungs and skeletal muscle. Okay, and what will happen in emergency situation? Lungs and skeletal muscle blood flow to be more, and here blood flow to be limited. That means arrangement of blood flow must be higher in that area. So another area you must control. So how it will control? So now come to the point. So alpha 1 and beta 2 according to the blood vessels. This is the blood vessel of other part of the body other than lungs and skeletal muscle. Here alpha 1 is present. So now this alpha 1, suppose if you think this is the membrane of smooth muscle blood vessel, then it will carry a receptor. This is alpha 1, and you know alpha 1 is attached with the coupled with the G protein Q, and that when your noradrenaline will bind with the alpha 1, then GQ protein will be activated, and then activated GQ will activate in that is your PLC beta, phospholipid C beta. When phospholipid C beta will be activated, then it will make two second messenger, that is IP3 and DAG, diacylglycerol, inositol triphosphate and diacylglycerol. Here some PIP2 and other conversion, but I will not go for details because G protein coupled receptor video lecture is available in my lecture. Okay, so that is IP3, and it will turn into, it will activate the PKC, and it will have another activity on the genetic material. And here that IP3 will go to the endoplasmic reticulum. Okay, and you know endoplasmic reticulum is basically act as a storekeeper of calcium. Suppose these are the calcium. So here IP3 will bind the IP3 receptor here, and then it will just exit. It will make the exit of calcium from the endoplasmic reticulum to the outside. These are the calcium. So what will happen? Intracellular calcium will increase. And smooth muscle calcium binding protein name is calmodulin. Okay. So what will happen? It will make calcium calmodulin complex, and that calcium calmodulin complex will activate another enzyme, that is the myosin light chain kinase. That myosin light chain kinase will just make the myosin. That means it will add phosphate. Then it will phosphorylate the myosin. So myosin will be phosphorylated. Myosin will be phosphorylated. Okay, this phosphate. Phosphorylated myosin is active, and this is inactive myosin. And this is active myosin. Then active myosin, phosphorylated myosin will bind with the actin. Then what will happen? It will make actin myosin complex and make the contraction. When blood vessel will contract, then here blood flow and peripheral resistance will increase and blood flow will decrease, and that blood flow will go to the in that area. It will facilitate to flow more blood to that area where it is very much necessary. Okay, so when the adrenaline or noradrenaline bind with the alpha 1 receptor in your blood vessels, basically for arterial region, in sphincter region, then it will contract the blood vessel. When blood vessel will contract, then peripheral resistance will increase, and peripheral resistance, and then finally BP will increase. Okay, so that will be happening in blood vessel other than skeletal muscle and lungs. Okay, so now what will happen in lungs? Now shortly I will explain. So this is your lung musculature, or you can say lung or airways muscle. Over both of the areas just carry beta 2 receptor. Okay, so in your blood vessel membrane of the lungs, it will just carry a receptor that is beta 2, and here noradrenaline will bind. And you know, beta 2 receptor is basically connected with GS. So what will happen when GS will be activated? Then within your membrane of the blood vessel of skeletal muscle and lungs. So we are just discussing about lungs. So here adenyl cyclase. And what would be the function of adenyl cyclase? Adenyl cyclase will just convert the ATP into the cyclic AMP. This is the second messenger, and that cyclic AMP will just activate pKa, that is protein kinase A, and that protein kinase A will just phosphorylate myosin light chain kinase in your smooth muscle, lung blood vessel or lung muscle. That is your myosin light chain kinase. You know, myosin light chain kinase is actually responsible for phosphorylation of myosin, and that myosin will be active to bind with the actin, and it will make the contraction. But here pKa will phosphorylate the myosin. Okay, it will add phosphate to the myosin light chain kinase. Then actually it will be inhibited. Its function will be inhibited by the phosphorylation. That means free myosin light chain kinase is ready to phosphorylate the myosin, but by phosphorylation, but pKa will phosphorylate the myosin light chain kinase. That means it will be phosphorylated. So phosphorylated myosin is actually inactive. It will not be able to just phosphorylate the myosin. Myosin will not be phosphorylated by the phosphorylated myosin light chain kinase. Then free myosin is inactive and it will not be able to bind with the actin, and no actin myosin complex, actin myosin complex, and no contraction. That means relaxation, that means vasodilation. Okay, that means here no, here no. Okay, so this is about the blood vessel of lungs. So when lung blood vessel beta 2 will be activated by noradrenaline, then it will cause vasodilation. It will cause the bronchial muscle dilation. That will facilitate to more blood flow to the lungs, more oxygen flow to the lungs, more nutrient flow to the lungs. That will be more functioning. Okay, and it will help to circulate the blood or oxygen to the skeletal muscle, and that skeletal muscle will just produce energy and it will help you to perform more. Okay, so this is like that. Okay, so this is the blood vessel related basic receptors. So in blood vessel, what type of adrenergic receptors are available? So you have to say throughout the body, most of the areas blood vessel carry alpha 1 receptor, and in some areas like skeletal muscle and lungs, blood vessel carry beta 2 receptor. Okay, so now I will discuss about another organ, that is your heart. So when you will do exercise, your heart function should be increased. So already I said most of the areas, the most stimulatory receptor is alpha 1, but exception is heart and kidney. So heart mostly carry beta 1. So beta 1 in heart, where beta 1 is present, it is SA node, that is your pacemaker, sinoatrial node, that is AV node, atrioventricular node, that is reserve pacemaker, and also cardiac muscle, basically ventricular part. Okay, so over there beta 1 is very much rich. How and why? Because SA node, AV node, bundle of his Purkinje fiber, it will just increase the conduction of action potential. So that is the dromotropic effect. Okay. Now, if you think that cardiac muscle, when beta 1 will be activated, it will contract the cardiac muscle. So enforcer contraction, that is the inotropic effect. And when inotropic effect is more, then what will happen? Your heart rate will increase. That is chronotropic effect is also will be high. So all the effects, when all the effects will be more, then your heart rate will increase, your cardiac output will increase, throughout the body blood supply will increase, your blood pressure will also increase. Okay, so in that way heart will help you to do more work, or in emergency situation heart will help you. So in heart, SA node, AV node, cardiac muscle, basically beta 1 is very much rich. Okay. In Purkinje fiber, beta 1 is also present. But in heart also, heart will supply blood throughout the body. And who will supply the blood to the heart? So heart has a coronary artery, and that coronary artery will carry alpha 1 and beta 2 receptor. Alpha 1 and beta 2. Alpha 1 is for contraction, beta 2 is for relaxation. So heart coronary artery carry blood adrenergic receptors alpha 1 and beta 2 in a very similar amount. That means the extent of those receptors are very almost equivalent for the fine tuning activity. Okay, And if you think about your Purkinje fiber, beta 1, and also beta 2, and other receptors are there. So I will say in heart, different types of receptors are present, but for better for functioning in emergency situation, most of the role is of your beta 1. Okay, so heart will carry mostly beta 1 receptor, but heart also has alpha 1 receptor, beta 2 receptor within your heart. Okay, so how that will increase your heart rate? Just I will just explain very briefly. Beta 1. So suppose this is your heart cardiac muscle cell membrane, and this is your beta 1 receptor. Beta 1 receptor, and beta 1 receptor, this is the G protein S receptor, and when G protein S receptor will be activated by the noradrenaline or adrenaline, then what will happen? GS will activate the adenyl cyclase, and then what will happen? Adenyl cyclase will just convert the ATP into the cyclic AMP. Then what will happen? That cyclic AMP will just activate PK, protein kinase A, and that protein kinase A will just activate a channel which is present in the cardiac muscle membrane. Okay, and then what will happen? This calcium channel, this is the calcium channel. Where exactly it is located, it has my another video is available in my channel, so you can go for that. Okay, what will happen when calcium channel will open? Then calcium will, these are the calcium if you think. Okay, that calcium will enter from outside to inside. So these are the calcium. Okay, so intercellular calcium will increase. In your cardiac muscle, calcium binding protein name is troponin. Okay, how? Just very briefly I will explain. So actually this is, if you think this one is actin, and actin is just covered by tropomyosin, and in the helical region in tropomyosin it is carrying the troponin, and troponin is the calcium binding protein. Okay, so what will happen when the calcium will bind there with troponin? Then the tropomyosin will be removed from here. Then what will happen? Your actin will be free, and that actin will bind with the myosin. Then what will happen? It will make actin myosin complex, and it will cause contraction. So when cardiac muscle contraction will occur, it will cause thus in force of contraction, that is inotropic effect, and that it will increase your heart rate. Okay, and it will increase your cardiac output, it increase the BP. Okay, so this is all about the beta 1 receptor activity related to heart. Okay, so already I covered blood vessel and your heart. So regarding this heart, how heart will take information to work more, then the signal will is actually connected with your basic area of your brain, that is your brain stem, and within your brain stem, particularly medulla oblongata. So suppose this one is your medulla oblongata, that means medulla oblongata. Okay, so this medulla oblongata is directly connected with your heart, actually carotid sinus aortic arch in that area, and also connected your blood vessel, and it is also connected to your lungs. Okay, lungs. So medulla oblongata has basically so-called three areas, center. That is your one is cardiac center, Another one is your vasomotor center, and third one is your respiratory center. Respiratory center. The medulla oblongata, the center point, that will regulate or control your heart function and blood vessel function and respiratory function. Okay, and over there, another name you can say in cardiac center, that can be considered particular area of the medulla oblongata, that is nucleus tractus solitarius, that is nucleus ambiguous. So this can be considered as a cardiac center. Rostral ventrolateral medulla, which is considered as a vasomotor center, and also there is dorsal respiratory groove is considered the respiratory center. So within the medulla oblongata, basically the major function is regulated and controlled by alpha 2 and beta 1, and alpha 2. So you know the beta 1 is mostly responsible for excitatory and alpha 2 is responsible for inhibitory, and of course also over there in different location, alpha 1, beta 1, alpha 2, beta 2, all the receptors are there, but most prominent activity is basically alpha 2 and beta 1. Heart, here the baroreceptor or chemoreceptor is present, and that will regulate or control the give the signal to the medulla oblongata, and medulla oblongata just reflects signal to the heart, and it will control the heart function. So when it will be sympathetic or parasympathetic, we are talking about sympathetic, so we will just show adrenergic receptor. In that way, in lungs and your blood vessel, vasomotor center through. Now, suppose in your nerve ending, this is the presynaptic terminal. Here the synaptic vesicle. It is the adrenergic neuron, and what will happen? It will just, this is the postsynaptic part. Okay, here the neurotransmitter will release, and it will bind with the corresponding beta 1, beta 2, or alpha 1 receptor, and it will activate that the next neuron or effector organ. What will happen? Here another receptor is there, that is the alpha 2, and you know alpha 2 is basically inhibitory receptor, that means G protein coupled receptor GI. Okay, and then how it will inhibit the neurotransmission of the adrenergic receptor, I will explain here very shortly. So this is the alpha 2 receptor of the presynaptic terminal. So this one is alpha 2. So here it will bind the noradrenaline. Then what will happen? It is connected with the GI. Then when GI will be activated, then it will inhibit the adenyl cyclase. Then what will happen? It will not be able to convert the ATP into the cyclic AMP. And when cyclic AMP will not be produced, then it will not activate the pKa. This cyclic AMP pK is very important to activate the synaptic vesicle to just release the neurotransmitter adrenaline or adrenaline from the terminal. Okay, so when in your medulla, when beta 2 receptor will be activated, then the neurotransmission of that corresponding adrenergic neurotransmitter will be inhibited. In that way, it will be regulated. Okay, so if you want to regulate or inhibit the sympathetic function, then you should take alpha 2 agonist. Okay, just try to think, then we will discuss about the agonist, antagonist, or their function in that way. So this is your medulla oblongata. That is your in the part of your brainstem. Here I want to add something. In your brain, throughout your brain, alpha, beta, both receptors, alpha 1, alpha 2, beta 1, beta 2, beta 3, all the receptors are present within brain. And this is not connected with the autonomic part, that is the sympathetic, or you can say peripheral nervous system, but within your brain. Suppose in prefrontal cortex, suppose your amygdala, suppose if your hippocampus, also different types of adrenergic receptors is present, because you know brain has within your brain adrenaline or adrenaline also can act. Okay, that is the different things. So now come to the another organ. So already I covered blood vessel, already I cover your heart, already we cover medulla oblongata. Now I will explain your kidney. Okay, so in kidney, already I said mostly beta 1 is very prominent, because if you think this one is your glomerulus, and this is afferent arteriole and efferent, this is your nephron. Okay, so in different areas, different receptors are there, but mostly for the regulation, for the blood entry or entry, afferent arteriole and efferent arteriole, over there alpha 1 is very much rich. Okay, and in the extraglomerular part over there and connected with the macula densa, there actually that will be in that area. The distal proximal convoluted will be connected there in a twisting way. So now here the extraglomerular areas, some specific type of cell. That cell is called juxtaglomerular cell, and then that juxtaglomerular cell membrane carry the beta 1 receptor. Okay, so if you think this is the juxtaglomerular cell, and it will carry the beta 1 receptor, and when adrenaline will bind with the beta 1 receptor, then it will release renin. Okay, and what is the function of renin? That renin will activate the renin angiotensin aldosterone system. Then what will happen? It will actually produce a biologically active compound angiotensin 2. This is very much vasoconstrictor, more than adrenaline or adrenaline. The vasoconstrictor is stronger vasoconstrictor, and that has several roles. It has blood vessel vasoconstrictor constriction. It has role in your adrenal gland, okay, to produce aldosterone, then sodium and water, then blood volume, then BP, and also has increased the vasopressin, that means ADH hormone released from the pituitary gland. Okay, in that way it will facilitate or increase the blood pressure throughout the body or maintaining the blood volume. Okay, so this beta 1 is very much rich in your kidney, basically in your juxtaglomerular cell. Okay, but in afferent arterial blood vessel also carry alpha 1, and throughout the area alpha 1, alpha 2, beta 1, beta 2, beta 3, all the receptors are there in a certain extent, but prime role of the kidney is beta 1 mainly, and also alpha 1. Okay, so this is the function of adrenergic receptor in kidney. Okay, so now I will go for your urinary bladder. So this is your urinary bladder. This is the sphincter muscle here. Okay, so in urinary bladder muscle, it can carry beta 2 and beta 3 receptor, and in your sphincter area it carry the alpha 1. Okay, so when you are in a sympathetic mode, then your urinary bladder will dilate and your sphincter muscle will contract. Then what will happen? It will just facilitate to retain your urine within your body. Okay, so this is the urinary bladder. Okay, and here in male person, if you think this one is your prostate gland and over prostate gland, alpha 1 is very much rich. Okay, so alpha 1 is very much rich in your prostate gland. So urinary bladder, prostate gland. Now I will go for liver. So in your liver, actually in emergency situation, or you can say for your more, when you will feel you need more energy, or you are in a excitement or anger mode, then your blood needs more glucose, and that glucose will go to the skeletal muscle to perform. Okay, so who will just facilitate to make more glucose into the blood? So that would be from the liver. And also, skeletal muscle itself carry or itself contain glycogen. Okay, so in liver, the glycogenolysis will be activated. The process will be activated or facilitated by beta 2 receptor, and also in the skeletal muscle. So beta 2 will increase the glycogenolysis and also increase the gluconeogenesis. Okay, and of course, in another way, it will within your liver, the glycogen synthesis will be inhibited at that time, because glycogenolysis is very much important. That glycogen will turn into glucose, and that glucose will just come into the bloodstream. And of course, in your skeletal muscle also glycogen, and that glycogen will be converted into glucose, and that will just reach to the cell or tissue level, and that will turn into ATP energy. Okay, so this is in your liver and your skeletal muscle. This is beta 2 very much rich, and of course there are other receptors also present, but more functioning way in sympathetic mode is basically beta 2. Now I will go for eyes. So suppose in your eyes, here your ciliary muscle, and it will carry your lens, and here the radial muscle in your iris, radial muscle. So radial muscle iris will carry the alpha 1, and your ciliary muscle basically beta 1 and beta 2. Okay, so when the ciliary, your iris radial muscle will contract, then it will make your pupil dilated. Okay, so within your eyes, alpha 1 is very rich for your dilation, and also beta 1, beta 2 receptor are present for particular function. Okay, so this is all about your eyes. So now I will go for your pancreas. So in your pancreas, suppose this is a pancreas, this is your beta cell, and beta cell is responsible for release of insulin. Amount of sugar will be regulated by insulin. So insulin release will decrease at the time. So over there, alpha 2 is present. So alpha 2 is inhibitory, and that will inhibit the insulin vesicle to release more insulin. Okay, so this is basically alpha 2, and also for excess glucagon release, other alpha 1, beta 2, beta 1 different receptors are there. But several times I am trying to say, most of the areas within your body, alpha 1, alpha 2, beta 1, beta 2 all are present, but mostly or prominent function, according to the prominent function, giving you some information. Okay, this is your beta cell pancreas. In your GI tract, GIT, the major function of the peristaltic movement is regulated and controlled by the acetylcholine. But here in your gut, the function alpha 1 and beta 2. Okay, that will actually decrease the peristalsis. That will decrease your peristalsis. Another one is uterus. Uterus has several roles during pregnancy and before pregnancy. So during pregnancy, your uterus dilation is very much important to carry the baby. So at that time, beta 2 receptor is very much active, and during delivery, your alpha 1 very much important for the contraction of the uterus to facilitate the birthing process. Okay, so this is all about the adrenergic receptors. Thank you very much. So based on the different location and function of the adrenergic receptor, if you just try to connect their function and location, then you will get some ideas what type of drug can be taken and how it will work and where it will be used. Okay, so just try to connect the previous discussion and just uh, try to memorize the name of the drug. Okay, so now come to the point. First of all, this is alpha 1 agonist. So alpha 1 agonist, already I said alpha 1 is very much rich in your blood vessel throughout the body, in basically arterial and sphincter region. Okay, to regulate the blood flow, that will contract the blood vessel. Already I discussed. So what will happen if you just take a drug that will make the contraction of the blood vessel, then you will get some benefit in a certain extent for certain region. That is, if you take phenylephrine, that phenylephrine can be used for your nasal congestion. You are suffering from nasal congestion, you can take, and that will contract your blood vessel within your nasal root, and it will help to remove from the nasal congestion. If you think, if you take this one in your eyes, then that will bind with the alpha 1 in your radial muscle of the iris, and that will make your eyes enlarged. That means people will be dilated. So you can use for your diagnosis purpose also. So that in that way you can use phenylephrine for your pupil dilation. Also, it can be used for cough. In some rectal preparation for blood vessel related problem, you can also use phenylephrine. Okay, so please try to understand the location and major function of the alpha 1. Already I said, if you in sympathetic pathway, alpha 1 is one of the prime modulator for sympathetic function. So it has major role for vasoconstriction. So in that way, that drug can be used. Okay. So now another agonist is your midodrine. That midodrine can be used for orthostatic hypotension. That means suddenly, abruptly, your blood pressure can fall down. Then you should take the midodrine, and that will increase the vasoconstriction, and instantly it will try to increase the blood pressure. Okay, so you will save from a sudden accidental problem. Okay, so this is the midodrine. So midodrine and phenylephrine, these are the agonists of alpha 1 receptor. Okay, so this one is alpha 1. Now come to the alpha 1 antagonist. So you know the alpha 1 is just for your vasoconstriction, one of the major function. So what should you do? If you are suffering from hypertension, okay, you are in normal situation, your blood flow within your organ and system should be normal. You are not in a sympathetic mode, so no need to specifically contract the particular area to just increase the flow to the lungs or skeletal muscle. Not such type of situation, you are not in that situation, but you are suffering from hypertension. So what is the problem? So you know hypertension is basically 90% hypertension is you don't know the real cause. So that is primary hypertension. So what should you do at that time? If you just take a drug that will inhibit the contraction of the blood vessel, so that will normalize that means that will inhibit the contraction of the blood vessel. So peripheral resistance will decrease and blood flow will be normal. So you will get rid of hypertension. That means alpha 1 antagonist can be used for hypertension. Okay, so prazosin can be used for hypertension. Actually, prazosin is not a mainstream drug, not first line, second line antihypertensive drug. You know, ARB or ACI or calcium channel blocker or beta blocker or diuretics. Those drugs are usually used for the mainstream drug, but this drug is basically used for those who are suffering from hypertension resistance. That means combination drug is failed to treat them. So that can, in that case, you can use. Also, aged people and the drug, conventional drugs are not functioning, so you can use prazosin. Okay, or emergency situation you can use prazosin. So that is the antihypertensive drug. Another one is tamsulosin. So tamsulosin is also the alpha 1 antagonist, but this drug also can be used for hypertension, no doubt, because the same location, binding location is the same. So it can be used for hypertension, but it has another role. You know, alpha 1, already I said, alpha 1 is rich in your prostate gland. You know, the prostate gland, it is the male body urinary tract contain the prostate gland, and that prostate gland will regulate the urine flow. So in the prostate gland, when someone is suffering from benign prostate hyperplasia, that means prostate gland has been enlarged, so it will just hamper the urine flow. So what should you do? You can take the alpha 1 blocker, and that will facilitate to urinate. That means it will promote your urination. That means it will just remove the hindrance of your urination. So that can be a good choice for prostate gland enlargement people suffering, that means patient. Okay, so this is the special type of use of tamsulosin. Okay, now come to the another one, that is alpha 2 agonist. So alpha 2 agonist, already I said alpha 2 agonist, alpha 2 is very much rich in your nerve ending. Okay, and that will regulate or control the adrenergic neurotransmitter. So if you just use agonist, and that will inhibit the further release of adrenergic neurotransmitter. So the next neuron or next effector organ will be inhibited. So how, you know, the alpha 2 is basically, you know, the GI receptor. So inhibitory G protein is connected with the direct receptor, and those receptor will be on the ending of the nerve. So already I explained there. So when you will take the clonidine or methyl dopa, that will bind with the alpha 2 receptor, and that will inhibit the adrenaline cyclase. So ATP and your cyclic AMP or PK will not be produced enough, and those are very much important to activate the blood your neurotransmitter basically. Already I explained, so I will not go for details. So what can I say now? If you take clonidine, that will enter in your brain, that is your medulla oblongata, your cardiac center, vasomotor center, and that will bind with the alpha 2, and as it is the inhibitory neurotransmitter, so that will be an agonist. That means it will change the conformation of the receptor, and it will help the GI, that is inhibitory G protein, and that will help to inhibit the further neurotransmitter release. Again, methyl dopa. Methyl dopa is also the alpha 2 agonist, but it has dual role. Methyl dopa will enter into your nerve, and that will turn into alpha methyl noradrenaline. That is almost identical structure of noradrenaline. That means a false neurotransmitter that can be released from the nerve. Okay, but here alpha methyl noradrenaline also can bind with the alpha 2 receptor, and that can inhibit the further neurotransmitter release for the activation of adrenergic neuron. Okay, so those drugs can be used for hypertension, because when a nerve will be inhibited, by its nature, and it will not release the adrenaline, then it will not increase your vasoconstriction or increase your heart rate. Okay, like that. So clonidine and methyl dopa can be a good choice for your hypertension. Basically, methyl dopa is for your pregnant mother. When a pregnant mother is suffering from hypertension, methyl dopa can be a good choice. Okay. Now, your alpha 2 antagonist. Actually, alpha 2 antagonist is not a mainstream conventional drug, is not usually used. So, eumbin, someone is suffering, male person suffering from erectile dysfunction, in a certain extent it can be used because mainstream drug is available for erectile dysfunction. So, it is not widely used drug, eumbin. Also, phentolamine. Phentolamine drugs is also like that, not the usual conventional drug. So soft tissue anesthesia for in combination with other drug, it can be used. Also, it can be used for when you withdraw the clonidine, that phentolamine can be used. In that way, it can be used in secondary level. So no need to focus more to eumbin or phentolamine. Now come to the beta 1. So beta 1 agonist. Beta 1 agonist is dobutamine. So you know the beta 1 is also the excitatory major receptor. Already I explained in the lecture. So when beta 1 will be just activated by an agonist like dobutamine, then it can be used for heart failure, because you know the beta 1 is very much rich in your heart, and it is present in SA node, AB node, and your cardiac muscle. Already I said. So what should you do? Your heart is going to fail. So instantly, if you take the dobutamine, then it can activate your heart. It can try to increase your force of contraction or heart rate or your other activity. So you can use for heart failure. Okay. So dobutamine is for heart failure. Now beta 1 antagonist. So already I said beta 1 is very much rich in your heart, also present in your kidney for renin secretion, that will activate the renin-angiotensin pathway. So that is also the factor for hypertension or your blood pressure elevation, and also in heart. So it will increase your heart rate, increase your force of contraction, as well as your cardiac output, like that. So what should you do? If you just take antagonist of beta 1, then it will inhibit the heart receptor of beta 1 in your heart, as well as it will also inhibit the beta 1 in your kidney. So it will decrease the renin release, as well as it will inhibit the beta 1 of a heart, and it will just inhibit the force of contraction and heart rate. So if your heart rate is decreased, your blood pressure will decrease, your renin release will decrease, your angiotensin pathway will decrease, vasoconstriction as well as sodium water retention will decrease, blood pressure will decrease. So what is the summary? That is, beta 1 antagonist can be used for hypertension. That is a good choice for hypertension, but nowadays it is not the first line, second line drug. Already new, different, good alternative drug already available in the market. So it is one of the major area is for your hypertension and for your cardiac failure. You can use for your angina, you can use for your after bypass surgery. It can be your lifetime achievement. Also, if you think you are a patient taking angioplasty, so you can take that selective beta 1 selective antagonist. That can be nowadays bisoprolol is widely used for that. Okay, so now come to the last one, that is beta 2 agonist. Beta 2 agonist, already know beta 2 is very much rich in your lungs. Already I said, your skeletal muscle. So you are suffering from asthma, you are suffering from COPD, you are suffering from difficulty of breathing, that is bronchoconstrictile problem. So what should you do? You know the beta 2 is for your vasodilation of your lungs, that means airways or airway muscle. So if you take agonist, that will activate your beta 2 receptor within your lungs or respiratory tract, and that will dilate your that means it will causes bronchodilation as well as vasculature dilation of your lungs. That will increase your airflow or blood flow. So it will be helpful for your asthma as well as you can helpful for your COPD. Okay, so that would be the good choice for asthma patients. So that is salbutamol or terbutaline. Okay, now the last one is beta 2 antagonist. So beta 2 antagonist, actually specific beta 2 antagonist is not available. Non-selective beta 2 antagonists are there. That means some drugs can also inhibit the beta 1 as well as beta 2. Some drugs also inhibit beta 1, beta 2 and also alpha 1. Okay, so such type of drugs can inhibit the beta 2 but along with the other receptors. So that can be non-selective beta 2 blocker, or you can say non-selective beta 2 antagonist. So this is the propranolol that can inhibit alpha 1, beta 1, beta 2, and you can say carbidopa that can be inhibit beta 1, beta 2, or alpha 1. Okay, so you can say that beta blocker, that can be called beta blocker, that can be called beta blocker, that can be called alpha blocker. Okay, so these are widely used drugs for anti-hypertension, COPD, or other drugs already, other factor already I explained. Okay, so this is all about the drugs associated with adrenergic receptor, that can be agonist or antagonist. Okay, so thank you very much for watching my lectures.